Everyone, this is Christy Wergeen with Stratus Health, the Minnesota organization that is part of the Lake Superior Quality Innovation Network, or LSQIN. The LSQIN represents Minnesota, Michigan, and Wisconsin under the Centers for Medicare and Medicaid Services Quality Improvement Organization program. I would like to welcome you to this educational session entitled Minnesota DHS Quality Improvement Incentive Payment Program, or QIIP, How to Choose a Performance Improvement Topic. This session is being recorded and will be available on the LSQIN website at www.lsqin.org in about 2 weeks. All lines will be muted during this webinar. However, after the presentation, we will have a time for questions and answers, so please make a note of any questions that may come up as you listen. We are pleased to have Val Cooke and Kim Klass as our featured guest speakers today. Val Cooke is the Manager of Nursing Facility Quality and Research for the Minnesota Department of Human Services. Her 24-year career has focused on nursing facility reimbursement and performance measurement. Ms. Cooke led the development of the Minnesota Nursing Facility Quality Measures and the pay-for-performance system, including the Nursing Home Report Card. She currently is responsible for oversight of the Minnesota Performance-Based Incentive Program, or QIIP, and the Quality Improvement Incentive Program, or QIIP, and other long-term care reform efforts that have an impact upon nursing facilities. Kim Klass is the Quality Improvement Coordinator for the State of Minnesota's Performance Incentive Payment Program, PIP. She has over 18 years of experience working in long-term care. Over the past 9 years, quality and performance improvement has been the focus of her practice. The PIP program has given her the opportunity to work with diverse groups of people and facilities on improving the quality of life and care they provide to the people they serve. Welcome, Val and Kim, and thank you for being with us today. I will now turn the presentation over to Val.
Good morning, everybody. I think we'll just jump right into the QIIP program background. The legislation for this program was enacted in 2013. So what we're going to be talking about today primarily is getting ready to launch into our second year of the program. The amount of funding that was appropriated for QIIP incentive payments was just under 1% of all operating payments for all Medicaid nursing homes in the state. So that works out to about $2.8 million state share. And since the QIIP incentive payment program is part of your daily per diem, we do get the federal match for that, and the private pay are also contributing to the program, so it results in about $7.5 million additional payments to nursing homes in the state. With that amount of appropriation, and we kind of had to take a stab at what we thought would be the maximum incentive payment that could be earned and still stay within the appropriation. So based on some historical data that we had from the PIP program on quality improvement achievements over time, we estimated that it will be about $3.50 per day. So that's where we set the maximum incentive payment for the first year, and we have not changed it for the second year. So we're still assuming that the maximum payment will be $3.50 per day. I think the other thing to remember about the QIIP incentive payments is that the funds are actually recycled every year. So you will need to re-earn that incentive payment. It doesn't go into your base for the following year. And the whole program, similar to the PIP program, it's intended to reward quality improvement and to create an incentive to work on quality improvement projects. So just to step back, I wanted to just share a little data we have on the QIIP results so far for the first year. We were very pleased that all but 3 nursing homes opted to participate in the first year, so that was just an awesome response rate, I thought. And most facilities chose a quality indicator to work on, and the most common was the antipsychotic meds. So we have 71 facilities that are working on that measure in the first year. And then we also have another 66 facilities that are working on both short and long-term pain. Looking at the data, we are only halfway. The data is only available for halfway through that first performance year. But we're seeing very encouraging results. 75 nursing facilities have already reached their target. But I also want to point out, if you're watching your goal there, those 75 homes will need to maintain that improvement at that same level or higher when we actually do the final analysis at the end of the performance year, which will be for the 4 quarters ending March 31st, 2015. I just want to note, for those of you that are anxiously waiting for the next QIs to come out, we'll then be 3/4 of the way through that first year. I expect that we'll have those in about a week. So if you want to visit the provider portal in about a week, you should be able to find the new QIs, and Kim will certainly send out her email notice when they're posted, as she normally does. Back again to just how's it going so far. Almost half of the facilities are trending positively toward their goal, so that's really good. Anywhere from 4% of their goal all the way to 98% on their way to their target. So we do have a large number of facilities that are doing really well. We have 86 facilities that have chosen a QI that are trending in the wrong direction. And so there's still 2 more quarters of data, of course, to see how those folks, if they've been able to kind of turn that around. We did also have 40 nursing facilities in that first year that chose to work on one of the risk-adjusted quality of life domains. And the 2 domains that were most popular in those choices was activities and the food domain. For those 40 facilities, you can now figure out what your incentive payment will be for the QIP programs beginning October 1st of this year. Go into the portal, look at your 2015 risk-adjusted results, and then as I get a little further into this presentation, I'll demonstrate on how to do the math. I was really hoping that we would have some statewide analysis on those 40 facilities that I could share today, but unfortunately we don't have it. But we will try to get that out to folks as soon as that analysis has been complete. So just to kind of get back to the QIP basics and where to go forward from here, the first step is to go to the provider portal. And after you've logged in, there is a tab at the top of the page marked QIP. So you'll want to click on that QIP tab, and you'll have a couple of options there. There is an instruction manual that's posted that helps you walk through how to read the report. And then the second option there is to actually select the QIP report for your facility. You will need to choose either one of the risk-adjusted quality indicators, and these are the Minnesota quality indicators, so don't confuse those with Nursing Home Compare or the federal quality measures. Or you can choose one of the quality of life domains, and all those options are on your QIP report for your facility. You will need to make your selections in the provider portal by March 31st, the end of this month. And just want you to know that you can go in and make a selection, just don't hit the submit button until you are sure of your final selection. But if something, I just really want to encourage you, if you hit the submit button, you've made a mistake or you changed your mind, it's, before the end of the month, just feel free to email Kim or I before that March 31st deadline, and we'll make sure that you have the ability to make a change on that selection. So just as a reminder, what is the baseline period for the second year? And that is the 4 quarters ending for the QIs. It's the 4 quarters ending September 30th, 2014. So those results have been out there for a while, and that's the period where your results are posted on the QIP report. So that is the reporting period where where the QIP report has drawn from to get that data. The baseline for the quality of life domains is from the interviews that were conducted by Vital Research last fall from September through November 2014. And those, again, you can find those if you want to look at your observed results and look at more in depth at those 2014 results. You can also find that data in the provider portal. So the intervention for this next year is now through the first quarter of 2016, again for the quality indicators. So the sooner you get started, the better. And the quality of life is now through the 2015 survey that will be conducted this fall, typically on the same time frame, starting usually end of August, early September. So the goals of the QIP program are set by, we use a standard for the risk-adjusted, both the quality of life and the quality indicators, we use a standard deviation method. And really what a standard deviation is just a statistic that tells how tightly the results are clustered around the average. So when you look at your QIP report, there's a column there labeled standard deviation, and you'll notice that some of the standard deviation numbers are quite small, some of them are quite large. So the larger the number there is, that means that the state performance is much more widespread and for that particular measure. I think meaningful activities is a good example, I think, where there's, where the lowest performers and the highest performers are quite far apart. And then there's a second test, and when we establish your goal, and so the idea of the QIP program is to reward quality improvement from a baseline, but we also wanted to have a standard that we want you to at least be above the worst 25%. So it's kind of like so we're rewarding improvement from baseline, but to get the full payment, we do have a minimum standard that we're expecting folks to be above. And so on the next couple of slides, I'll try to talk a little bit more about how that works. So in this example, we're looking at prevalence of UTIs, and these numbers are totally hypothetical, so don't, it's just for demonstration purposes only to help you understand how we set the goals. So if, for instance, your baseline rate of your UTIs was 7.6%, and on the QIP report, if it said, and it doesn't say that, but if it said that the standard deviation for that particular measure was 2.944, we would look at the two ways to look at your goals. So the first way, using the standard deviation approach, would be taking your baseline, your 7.6%, and multiplying one deviation, because in this particular QI, a lower number is better. So we're seeking to decrease our baseline rate. So you subtract the standard deviation, you end up with a 4.66% rate of UTIs. The 25th percentile goal, so again, this number is a hypothetical, it's not actual, but that would mean that to be at least 25% from the bottom of the array, you would need to be at least down, your UTI rate would need to be down to 2.496%. So when we compare the two goals here, in this particular example, this facility hypothetically is doing a pretty poor job on UTIs, and so just doing the standard deviation did not bring their rate down far enough to meet that minimum standard test. So in this case, the goal would be the 2.496%. So I mentioned earlier that if you had chosen a quality of life, there's a way you could calculate your incentive payments. So what I'm trying to do here is demonstrate how you calculate how much of a rate increase you're actually going to get once you have your results. So in this case, I didn't particularly choose any measure, but let's say that your baseline was 7.6%, your goal is 2.5% approximately, and you only got partway there, so you achieved a rate of 3.2%. So you take the math and you look at your baseline and you minus what your goal is, and you'll see there is about a 5-point difference there, 7.6 minus 2.5. So that's how much your rate should have improved if you were to meet your target. Then you calculate, well, how much improvement did I really get? And so again, you take your baseline, and then you take your rate of 3.2 that you actually achieved, and you calculate that difference. And you'll see that the difference is 4.3. So you were supposed to get 5.1, you only got 4.3, So the next step then is to figure out, well, what proportion of that goal did I achieve? So you take those two differences, the 4.3, divided by your goal of 5.1, and you'll see you made 85% of your goal. So you take the 350 times 0.853, or the 85.3%, and you see that you have earned 2.99 per day. The 350 is per resident day. Okay, the next slide. Now this is where I'm really going to see who's really paying attention. Get a pencil out. If you printed out the handouts to take notes, just moments before I headed over here to do the webinar, discovered that there's an error on the slide here. So the column, but we can still go through this because, again, we're just doing this as hypothetically, so I could still try to help you understand, how to read this report. But take your pencil and mark out, cross out the column that says goal using percentile methods, 25th or 75th. The numbers in that column are not accurate for these measures. They're actually reversed. So what the numbers that are presenting to you there are showing you that the minimum standard, you'd have to be the best 25% of the state, not get above the worst 25%. So I'm very sorry for the confusion on this. We will correct the slide, and it'll be fixed before the materials are posted on the website. So we'll have that fixed. And so with that, we just fixed it in the provider portal right before we came as well. So if you've printed off your QIP report prior to this session, please go back and print out a new one because the data's been corrected. But I wanted to walk through how this works. We take the first one, the worsening or serious resident behavior. You see the risk-adjusted facility rate. That's the baseline. You see the standard deviation in the next column. So the goal using the standard deviation method is the difference between the two, similar to what we walked through on the previous slide. If, in fact, this number was right, the goal using the percentile method there would be 8.937. Since 8.937 is a higher standard than the 9.402, the goal would be the 8.937. Let's move on to the next one. For prevalence of depressive symptoms, this facility is already doing very well. And you'll see this quite often on your QIP report. So if you take the baseline and subtract the standard deviation, you end up with a value that's less than 0. Obviously, you can't improve to something better than perfection. So this is not a measure that you would want to select for your QIP program. And so you'll see over on the right-hand column, your goal for full incentive payment, it actually marks that as a measure that's not available to you. So it's really important to watch for those NAs in that last column because we actually, I think, didn't have an edit in place in the first year, and I think a couple facilities ended up doing that by accident probably. So we are prepared at our end, as all quality improvement projects, figure out what can we do better the second time around is, to try to catch that, we would contact the facility if that happened. But so you really want to stay away from those measures where you have an NA, where you're performing so well that you would end up better than the best you can possibly be. So let's see, we could select, I think, that kind of covers the various scenarios. I wanted to make sure you understood that you can get values less than 0, and then how the last column will select whichever the standard is appropriate in your situation. It'll show you what your goal is for the full incentive payment, and those are all going to be highlighted in red. It's a very confusing concept, so if we have time at the end, I can try to help. We could try to answer some more questions about that, or feel free to email or call Kim or I. Kim's looking at me like, no! She always tells me that she's a nurse. She can't handle these percentiles. But we will certainly help you try to understand that. But again, I just want to emphasize that please go back to the portal and print out a new report if you already had done that. And with that, I think I'm going to turn it over to Kim.
All right. Hello, everyone. So I thought I would just go over choosing, once you choose a QIIP project and how that process works again. Some of you are very familiar with that, but when we did the last webinar, there was a lot of response and asking, what do you do when you do identify a problem, and how do you create a plan to correct it? So I thought I would go over that for those of you that are struggling with that. So choosing your project, the first thing is review the data and focus on areas where you're scoring poorly. And choose an indicator you may already be working on in your facility, or continue working on an indicator you used for your last QIIP or your current QIIP project. So those of you that are already working on QIIP projects, you can choose an indicator for QIIP and work on the same ones at the same time. There's no penalty for that. And also, if you look at what you chose last year, and you can, if you're in your QIIP, and you see that you're not doing well, you can again choose it again this year and work on it again. So, if you're currently working on either one of those projects, make sure that you choose the indicators that you're already working on, so you're not recreating the wheel. Let's see. So let's talk about data. Data is used to analyze what's happening in the facility and how we measure for improvement. It provides a baseline for improving negative outcomes. It assists you in setting goals and is used for evaluation and determining if you are improving. And one thing, too, I want to emphasize all the time is that data should always be reviewed for validity. Each time a report is generated, you should be reviewing the information and coding for accuracy. Never assume that the system you're using to calculate your data is accurate. Remember human error. People who set up the system or people entering information may not be doing it correctly, or the information may be inaccurate. So reviewing the data is the first step in the improvement process. Baseline data. Baseline data is a snapshot of how things are when you start the project. It gives the actual number of residents involved and the actual number of times it happens. So I thought we would use the frostbite falls example out of the instruction book as we walk through this. So this example on the Minnesota quality indicators, they score terribly in the prevalence of physical restraints, a measure where the lower score is better. The facility has a score of 19.783% and the highest in the state. One standard deviation on this measure is 1.992. So the goal would be to reduce their score by 1.992 to 17.91. which would be well above the 99th percentile, except they must get at least to the 75th percentile so that their goal is 0.790, reducing prevalence by 96%. So Frostbite Falls has identified this as a problem in their facility after reviewing their data for accuracy, and they start the improvement process. The first step is forming that team, and this is really important. You want to make sure on your team that you have staff that directly impacts this problem so that they bring an understanding of why these physical restraints are used and can offer feedback based on past experience. Staff which are not directly impacted can offer feedback based on different perspectives, and residents, families, and neutral parties can bring first-hand insight into the problem. So having the right team that will have a direct impact on your improvement process and the sustainability of your project. And when you form that team, you should also make sure that you form ground rules. This is important so everybody understands their role. All titles should be left outside the room. All discussion is confidential to the team only unless otherwise specified. Each team member will openly listen to the viewpoints of the other team and will not judge or label. We'll set timelines for length and how often the teams will meet, and the meeting agenda will be provided before each meeting. Each member should come to the meeting prepared and reading the minutes before they meet. Each meeting begins with a summary of the last meeting, and all feedback is constructive and avoid criticizing. Defining a problem. The next step is defining the problem. You ask, why is this a problem? What impact is it having on the residents, the families, and the facility? And what are the consequences of not solving this problem? What is the difference between the way things are now and the way that we want them to be? And then we look at the goal. The goal is a clear statement of intended improvement on how it will be measured. Use your goal to stay focused, establish boundaries, and define success. Post your goals at every team meeting, and goals should be measured by the same method you've collected your baseline data. Example of a goal for Frostbite Falls would be to reduce their physical restraints from 75% to 25% by November 2015. And another goal could be the facility will be restraint-free by April 2016. And it's important when you're doing that and you're setting this action plan up and you're meeting as a group that you write those out so that people see them. Because and also the rest of the staff in the building see those too, so that you remember that this is what we're working towards, so we don't get lost in the strategies and everything that's going on, and that we remember. The next step would be to do the root cause analysis. So now that we see the problem, we want to be able to identify, is this problem real? What is the root cause of this problem? And STATUS does have some information on their website too to help with root cause analysis with the sheets of the 5 whys. So I would suggest, and it's important that you teach staff how to do root cause analysis. So this time as you want to look for reasons the problem is happening, brainstorming with everyone to get their opinions without judging it, trying sticky notes. Oftentimes when people are in a room, they don't want to talk about, they get really quiet, they get nervous about talking, so using sticky notes to get people to share. Keep asking why until you uncover the true reason the situation is happening, and remember, you want to have a lasting solution and not quick fixes. So the example of the problem, the Minnesota QIIP report shows we score the highest in the state for physical restraints. The next step would be to review the systems and processes, resident safety, reviewing the organization's ethics, the regulatory compliance, risk management, resources, budgeting, orientation, staff education, resident records, resident rights, and satisfaction. You want to ask staff, why are residents restrained? Interview the residents and families regarding physical restraints and brainstorm with staff from all disciplines. Example of what's discovered. So you look at the systems and processes in Frostbite Falls promotes physical restraint use. They believe that keeping people physically restrained promotes safety. It's staff's lack of knowledge regarding restraints, and family insists on restraint use, and then poor quality of life. You want to continue asking why again. You ask, why do we use restraints? Ask, why are restraints viewed as safe? Ask what education is provided on restraints. Ask why families insist on restraint use, and continue to ask, why until all the reasons are discovered. Possible root causes. For frostbite falls, their possible root causes could be there's no systems or processes in place to reduce restraints, no education in place to address the dangers of physical restraints, no education on resident safety, and no plan for restraint reduction. Root causes. Once the true causes have been discovered, strategies can be developed to improve communication, clarify staff expectations, and solicit resident input. So the next step now is to create the action plan. Creating an action plan. It's a guideline used to keep the project on track and to hold everybody accountable. So in this step, we're asking, what are we doing? What should we be doing? What should we be doing next? How should we be doing it? And how should we not be doing it? We'll provide guidelines for writing the plan. And then the action plan identifies the short and long-term goals. It lists objectives, identifies roles, lists strategies, identifies timelines and measures, and implementation and evaluation. The last step is the evaluation of the action plan. So if you look at the PDF-A cycle, this is where we use that. I know that strategists use it a lot too in talking about plan, do, study, act. So that's really important part when we're looking at doing this. So when you're monitoring it, you're actually in the S stage there of the studying. So you want to make sure that when you're looking at a plan, you have your action plan together, you're going to get ready to implement your plan. What are you going to do to monitor it? So it's important to be looking at what data is going to be collected, who's going to be responsible for that, how often are you going to do it, and then assessing how are you going to assess those strategies that you put in place. And the last part for the evaluation, here, you want to make sure, how are you going to evaluate this? Who's going to evaluate it? How often? Who's responsible for reviewing the findings? And then how will you evaluate for success? And this is important because when you're in the evaluation, it shows you what's working and what's not working. And the evaluation provides the opportunity to refine, modify, and expand, or abandon the change and try something else. I see that often when, with the QIP projects, and, when I ask somebody, how are you going to monitor this project and evaluate that, it's always a weakened area when people write those RFPs to us. But it's really an important part because you need to be able to understand that once I implement this plan, I need to go back and make sure that what I put out there is actually working and making sure I know how I'm going to audit and who's going to be responsible. And then again, with the evaluation so that you can change things as you go along. Because it's not always going to be the same. So making sure those pieces are in place are really important. And then tips for improvement. Looking for ways to improve. One of the things, too, is not to jump to conclusions without proof. That's why root cause analysis is really important. You think it's a problem, or even looking at your data, you may see this data and you may think, oh, I'm doing really, really poorly in this area. And then you may discover that it may be a coding problem. So you don't want to start the whole process and changing systems when it may just be data is being inputted incorrectly. So always making sure that you start from the beginning and you do really good root cause analysis also gives you opportunity for strategies. So when you're identifying those things that aren't working or that are wrong, but they're still not the root cause, you develop strategies to address each one of them. You want to consider the impact of your actions too. Everything is a domino effect. So you change one thing in the facility and there's multiple things that change along with it. So one of the things too is starting small in a smaller area to help that to help the impact, and to help see what's going to be impacted in the facility as you move forward. Stop departmentalizing issues. So we really need to stop siloing in the homes. We need to start having everybody work together as a team and come together as a team. And consider what each department can do to solve problems. Everything isn't just a nursing problem, and everybody can bring really good insight into problems that are happening in the facility. So making sure that we're tapping into all of that. Again, when you're implementing a change, do it in a small area. Don't do that throughout the whole entire facility. I've done that a couple of different ways, and it's harder to fix something that you realize isn't working when you've already implemented this throughout the whole facility. So start small and then spread out. And then realize that everyone has equal responsibility to the residents. And creative thinking. You cannot solve the problem if you come to the table with the same thinking that created the problem. Thinking out of the box inspires new ideas and learning opportunities. And that's my story. So, Christy?
Thank you very much, Al and Jim. We will have plenty of time for questions in just a bit. But before we open it up for questions, I want to remind everyone of the opportunity that all nursing homes have right now to join the National Nursing Home Quality Care Collaborative. I know that many of you have already joined, but for those that have not, when you join, you will be put on the contact list to receive information about free educational opportunities such as this. And as I listened to Kim, and she was talking about things like root cause analysis and PDFA and how to do an action plan. So that's exactly the kind of things that we're going to walk each home through. Because there's a lot of information, so I know you probably will need a little bit more support on this. I also want to let you all know that so far over 5,000 nursing homes in the nation have joined the National Nursing Home Quality Care Collaborative, and we certainly don't want any of our Minnesota nursing homes to be left out. So if you are participating, what you're going to get is some free educational and collaborative opportunities, as well as the latest evidence-based practices and resources that will be provided with the goal of improving systems of care that lead to better quality outcomes for your nursing home residents. You'll also be able to choose which free educational opportunities you'd like to participate in to support the work you're already doing, such as the work to make improvement in the QIIP topic that you choose. And so we're not going to ask you to choose another improvement project. We want to make that clear. We just want to support the work that you're already doing. We'll also be providing participating nursing homes with opportunities to collaborate and learn from each other. So we'll have a great opportunity to hear what other homes are doing, some of your peers, what they're doing, get some really good ideas. And we're also going to send you data reports to help you track your progress. And some of these data reports, for example, the composite score, the QIO, we're the only ones that have that, so we'll be able to share that data with you. So in the handouts for today's webinar, you will find the instructions on how to join the National Nursing Home Quality Care Collaborative if you already haven't done so. It's very easy to do. You can easily join electronically using the link that's on the handout. It's also on this slide here. And please join as soon as you can because we have several learning opportunities planned, and we want to make sure that your nursing home receives invitations to participate. If you have any questions about the collaborative, please contact me, and the information is on this slide. Okay, this is great. We do have plenty of time for questions, and I see there are already some in the chat. So I think most of these might be for Val. So Val, why don't you go ahead and address those questions in the chat, and then we'll open the lines up.
Okay, so the first question again was about the $350 per day. I just want to clarify that's per resident day, so it's a part of the daily per diem. And as I mentioned earlier, then it's part of your private paying daily rate as well. And then the next question is back to choosing based on standard deviation. How do I find the standard deviation on the QI report. I printed the QI this morning. Is it outdated? So the QI report, I think if I understand which report you're talking about, there's a difference between the QIP report and the QI report. So the detailed QI report does not have the standard deviation on it. But if I were going to be approaching the assignment of picking my QIP measure, I would print out the baseline quality indicator report, and I would put it side by side with the QIP report, and then I would also print out the most current available QI report. So, like I said, in another week, there will be fresh data, already 1 quarter past your baseline, so you can see, start to see if you're trending in the right direction on any particular QI. So on the QIP report, the standard deviation is on there. That's the second column that I went through earlier, and so you can find the standard deviation there. Those numbers, if you had printed your QIP report prior to today, the standard deviation numbers will not change. It's only the column on the goals using the percentile methods where the numbers will change, and you'll want to get a new report. The next question, is there a way to get the information that triggers the numbers? The portal does not update throughout the year. How can you track progress? I'm going to take these questions one at a time, I guess. Is there a way to get the information that triggers the numbers? I think what you're looking for is to find out which residents triggered the QI. Mm-hmm. Now, the Minnesota risk-adjusted quality, our reports do not have identify the residents that triggered the QI because our QI reports are 4-quarter rolling averages. And so what I would recommend in this case is that you go to your federal reports, and where you are able to determine, they will tell you the residents that triggered certain QIs. The Minnesota QIs and the federal QIs are very, very similar. The same residents are likely triggering. The difference between the two is the risk adjustments. Minnesota's measures risk adjust more extensively than the federal ones. Then I believe the next question was, how do we track our progress for QIP, because the portal does not update that throughout the year, and that's correct. As I was sitting here, I'm thinking, wow, that would be a really nice feature to have some dials or something. Certainly something we could think about trying to develop in the future, but there isn't a way. We don't have that capability at this point. So again, it's important that you work with the QIP and your QI reports together. So at this point, you're on your own to keep. Whenever new QI reports are posted in the portal, take a look at the measure that you selected and see, are you getting better? And are you, how far close are you getting to the targets? Is the risk-adjusted facility rate determined on final numbers or averaged over 4 quarters? I think I just answered that question, that all of our posted quality indicator reports are for a 4-quarter rolling average. How do the adjusters for each indicator affect the rate? So the best resource for you to answer that question is to go to the quality indicator tab in the provider portal. And when you click into that page, at the top of the page, there's instruction manuals and detailed descriptions of each of the quality indicators. And so you go into that document, and there's one page for each of the indicators, and it'll describe to you what the risk adjusters are, which conditions will exclude the resident from that indicator. So there's a lot of good detailed information there. And if you're having trouble understanding that, give Kim Class a call or email her. If you have specific questions about one of the quality indicators, either Kim or Teresa Lewis will get back to you with more information about that. The next question is, where can we get the handouts?
Okay, so the handouts are available on the Events tab, right on. So if you're in the on the web page, on the very top, there's an Events tab, and if you click on that tab, you will be able to get the handout. Also, just so you know that we will be on the LS2IN website. We will be sharing this recorded webinar with the handout, and Barbara's showing you here. If you click the event info, the event tab. Okay. So, can we get a copy of these questions with your answers? Would you be able to? We can do that. So, we'll make sure that we get the questions written down, and then we'll make sure that they'll price up answers, and that we get them out to you. Now, there might be some questions over the phone. So, Wes, can you remind everybody how to get into queue to ask a question?
Certainly, the floor is now open to your questions. If you have a question or comment, please press 7 or Q on your telephone keypad.
Can I keep going with the chat room question?
Yep.
There's a question about the descriptions about the risk adjusters and exclusions, tell you what they are, but not how it affects the percentage. The exclusions means that if a resident has that condition, they're completely taken out of the QI. The risk adjusters, what that is doing is taking a condition. Let's say I need to look at an example here. Kim, help me out. So a worsening or serious resident behaviors, there will be certain conditions that would predict that that resident is more likely to have an issue with behaviors.
Yes.
And so we would adjust the facility rate down if you had several residents that had a condition that would contribute to behaviors. So can you think of an example? I don't have the descriptions in front of me.
Yeah, and I'm trying to think too. Yeah, those things, and if you then for diagnosis too, those would be more exclusions though too. When you're looking at serious behavior and resident behavior.
Well, let's take a different QI. Weight loss, for instance. Somebody has a cancer diagnosis.
Yep, they would be excluded. Hospice people are excluded from that. So you take those people that are excluded out of that mix, and then you would use the risk adjusted piece, and that would go by age. And there's all those different factors that go into the risk adjustment. So you have to go in with the instruction book and look at each one of those QIs, because it's very specific and it's really easy to see what's being taken out of there and what isn't. So once you take the exclusions out of there, then the numerator is listing those residents who do have serious behavior, and those are the people that you want to be focused in on. Then, they're the ones that are triggering on your MDS.
So for this question, as far as the 5-star rating with the changes that were just happened a couple of weeks ago, did any of the Minnesota QI exclusions change because of that? Probably not. Yeah.
The Minnesota QI has not been adjusted for 5-star changes.
I didn't think so. Okay. Okay. Great. And then there's another question. Where can I get last year's?
Where can I get last year's current QIP goal? I think you're going to have to contact us, because when we put up the new QIP report, it replaced the 2014 report. So go ahead and email Kim or I, and we'll have to go and look that up for you. But that brings up a good point too, because that's something as when I was kind of doing some research, it's like, oh, we just replaced the 2014 report. I think it would be good to keep that on the portal. But we'll see if we can get that back on the portal within a relatively short time. But in the meantime, if you don't know what your QIP goals are, go ahead, feel free to contact us, and we'll try to help you.
Okay. Wes, are there any questions in queue?
At this time, there are no questions, but as a reminder, for a question or comment, please press 7 or 2.
Okay, and feel free to write in chat, too, if you have any more questions. Okay, no one in queue, Wes?
At this time, there are no questions over the phone.
Okay, then I think we'll go ahead and end the webinar. And we will take these questions and get written out, answers out and send those out. So thanks for that suggestion. So this concludes this educational session. Thanks again, Val and Kim. You'll all receive a link to a short evaluation form via email after this webinar is over. And please take a minute to provide feedback on today's session. Once you've completed that evaluation, you will all receive a certificate of completion. And please make sure that everyone on your team that has participated in this webinar receives a copy of this certificate. Once again, this session was recorded, and it will be available at www.lsqinasnancy.org in about 2 weeks. Thank you all for participating, and have a great afternoon.
Thank you. To conclude today's teleconference, we appreciate your participation. You may now disconnect your line at this time.
Thank you.